bleeding after sex may be the first hint that you get that something may be seriously wrong. It's always essential to have it checked as soon as possible. Hi everyone, I'm Dr. Sylvia, a general practitioner and health educator. This is AskAwayHealth, where we provide you with clarity and direction about everything medical. If this is the first time you're coming across one of our videos, welcome. I hope you will subscribe to the channel and don't forget to click the notification bell so that every time we push out a new video, which tends to be once a week on Saturdays, you will get to know about it. So everyone, this is the first of a new series of videos that I'm going to be doing, which I call Bleeding After, where I'll be talking about abnormal bleeding episodes or bleeding conditions, the causes and what you should do. So if you're interested in problems like bleeding after sex, bleeding in your stool, blood in the vomit, blood in the urine, make sure you subscribe to the channel as they'll be coming your way soon. So today's topic, bleeding after sex, I'm primarily addressing women, but if you're a guy and you just happened across this video, make sure you share it with any of the women in your life, because you never know when it might provide some use to them. As a woman, the only time when bleeding from your vagina is normal is during your menstrual period or within the first few days and weeks just after having a baby. You might also bleed after you've had a gynecological procedure or even after having a cervical smear. Generally, these will be light episodes of bleeding which you expect to stop within a short period of time. So, if vaginal bleeding happens outside of these periods, particularly after sexual intercourse, please take it seriously. Now, what is bleeding after sex? It simply means the passage of blood through the vagina, either during sexual intercourse or within a few minutes or even several hours afterwards. The amount of blood or the degree of bleeding can be variable, so it could be spotting that you find on your underwear, or the bleeding could be a lot heavier, such as the flow that you experience during a period. Regardless of the quantity, please do not ignore it. And even if it's just happened once, do discuss it with your doctor so that we can be clear about what's causing it and work. So, as I like to do, before I look into the causes of any problem, let's look at the structure of the tissues or the organs involved in this condition. What does your reproductive tract look like inside? We'll start with the vagina, which is an empty or hollow muscular tube that starts from the opening in your vulva and stretches upwards to end where the first part of your womb or the cervix begins. So the first part of your womb is called the cervix, is also known as the neck of the womb, and it's the part of the womb that slightly juts into the vagina. The womb itself is made of muscle and is supplied with a very good network of blood vessels. So when we're thinking about the causes of bleeding after sex, we will be looking at possible problems or conditions that will affect the reproductive tract organs. Number one, infection. Now, most of the time, this refers to sexually transmitted infections or sexually transmitted diseases. Infection with a sexually transmitted germ can make the vulva, the vagina, the cervix tissues inflamed and bleed, causing what we call a bloody discharge. And the friction of tissues rubbing together, as happens during sexual intercourse, can cause more bleeding afterwards. Another type of infection is known as pelvic inflammatory disease, PID for short. Now, PID is a term we give to an infection of the upper reproductive tract in the woman. So we're talking about the body of the womb, the ovary, the fallopian tubes and the ovaries. Most of the time, PID is caused by a bacterial infection that spread up from the vagina into the higher parts of the reproductive tract. In addition to causing pain on deep penetration, one of the other symptoms of PID is frequently bleeding after sexual intercourse. A woman who is sexually active is more likely or more at risk to experience or suffer from a PID. Using condoms and practicing safe sex reduces your risk of developing a sexually transmitted infection and developing PID. Number two, let's look at vaginal dryness. Usually the tissues of the vagina, the other parts of the reproductive tract are maintained. In the absence of estrogen, or when its levels are reduced, the tissues of the vagina and the vulva can change. This means they become thinner and dry. The dryness makes it more likely that during sexual intercourse, when tissues are rubbing together, there can be pain with bleeding from both the vulva or the vagina. Now, there are quite a number of circumstances when a woman can experience vaginal dryness naturally. They include things like pregnancy, breastfeeding, and menopause. Also, certain drugs you take to treat other medical conditions can lead to dryness. Examples include some birth control or contraceptive medication, some drugs used for treating depression, some cold remedies or anti-allergy medicines that contain antihistamines, and in some cases, some medicines used for treating high blood pressure. So it's worthwhile, if a woman starts to experience bleeding after sex, to look at whether the nature of the vagina has changed for one of these reasons that we've mentioned, and look at how we could reverse it. Number 3, experiencing vaginal injury or trauma is another common cause of bleeding after sexual intercourse. Most often, this refers to the type of trauma or injury that a woman might experience during childbirth. In a vaginal birth, a lot of first-time mothers might experience a graze or a tear in their perineal area, that is the area between the vagina and the anus. This usually happens as the baby comes out through the vagina, out of the birth canal. And in some cases, the doctor might have to give the woman a cut in order to widen the birth canal and allow the baby to come through easier. Most of the time, we do this if the baby is in distress and needs to come out quickly, or if we're going to use assisted vaginal delivery, in which case we're using forceps or vacuum. Or a woman might also get a cut in her perineum if doctors are concerned that she's pushing quite hard and straining and is at risk of giving herself a severe tear all the way to her anus. So these are the reasons that a woman might sustain a vaginal injury around childbirth. But what about other conditions? A woman who is not well lubricated in the vagina before sex may develop an injury. This is because the Bartholin's glands are two small pea or peanut-sized glands that sit behind the labia on either side around the entrance of the vagina. They are responsible for making the fluid that lubricates the vagina during sexual intercourse. Having sex without adequate lubrication, if the ducts from the glands to the vagina are blocked, or if the glands are infected, or if the woman is simply not in a state of arousal, can cause injury to the tissue. And this is the case whether one is having penetrative intercourse with your partner or using sex toys. Number 4, let's look at another cause. This happens from benign growths of the cervix that we call polyps. Now, they can happen in the cervix or in the body of the womb. Now, because they tend to go outwards into the vaginal canal, it means that during sexual intercourse and thrusting, it might cause pain, and the friction contact between your partner's penis and those tissues could cause them to bleed. Remember that polyps are benign growths, and so they do not cause cancer, but they can be a cause of bleeding during or after sexual intercourse, and we should identify and treat them properly. Number 5, cervical erosion. This is when there is an altered or changed aspect to the surface of your cervix. It's also known as a cervical ectropion. A cervical erosion happens when the type of tissue that you normally find internally within the cervical canal now comes out and is found on the surface of the cervix. The tissue types in both areas within the same organ are quite different. The tissue types you find inside within the canal are called soft cells, and they look redder than the hard cells which you find on the surface of the cervix normally. When soft cells are located on the surface of the cervix and your partner's penis bumps or hits against them during sexual intercourse, they are more likely to bleed. Women who develop cervical erosions do so because of hormone changes. Commonly, these hormone changes happen in pregnancy or in women who use some types. Again, having a cervical erosion, just like polyps, does not mean the same as having cancer of the cervix. And the last cause I'd like to look at today for possible reasons a woman has bleeding after sex is cancer of the cervix or the womb. Although it's a rare cause of bleeding after sex, it's essential that every woman must be aware of the possible relationship between this symptom and cancer of the cervix or the womb. This is why we encourage you to report any unexplained type of bleeding after sexual intercourse or any unusual bleeding from your vagina to your doctor so that we can test and find out what's causing the problem. Some of the key health measures women can take to prevent developing cancer of the cervix: be aware of your body and any changes. They should make you contact your doctor promptly to discuss the changes and make sure they're not due to some sinister cause like cancer. Ensure you attend cervical test appointments regularly. Don't postpone them, don't miss them. Smears can help us identify any changes or abnormalities in the cervix before the development of cancer. And take the HPV vaccine. Infection with the human papilloma virus HPV is one of the most significant risks associated with developing cancer of the cervix. Certain types of HPV can cause genital warts, but other types which can lead to cancer can be asymptomatic, that is, they don't show any symptoms and can be spread amongst people who have sex with each other. Having the vaccine greatly reduces your risk of developing the infection with the virus and developing cancer of the cervix. So these are a few conditions where you could develop bleeding after sexual intercourse. Remember, if you can't explain it, discuss it with your doctor. The earlier the better. If you found this video helpful, then watch my video on the causes of painful sex. I'm going to put a link to that in the description below. And let me know if you have any comments on this topic. Don't forget to share with a friend and like the video. I hope you'll subscribe to my channel if this is the first time you're watching, and don't forget to click the notification bell. Until I see you again, stay well.